Dr.Amrit. I'm an obstetrician and gynecologist, and I'll be talking about colostomy care in infants today. The method that I'm trying to tell you, it uses the things that are easily available at home. So the ideal way to care for a colostomy in any individual is through colostomy bags. But some people find it difficult to use those colostomy bags, particularly in infants, because of various reasons, and some of them being that they're not. One is that they don't know, or they're not properly taught how to use a colostomy bag. Secondly, the infant keeps on moving its limbs, so it gets kind of difficult to keep it on for 1, 2 or 3 days as much as it is required. So you tend to change it quite frequently, and that becomes a problem in infants, because you have to remove all those tapes again, and it kind of, because their skin is very soft, and it sometimes gets peeled off because parents are not that experienced with these things, because these are the things that ideally should be done by professionals, because they are required to be done on an everyday basis, so parents need to learn them, and the facilities everywhere are not as good as they should be to teach parents how to do the colostomy care properly. So this is a simpler version of doing a colostomy care at home with the normal household things that you have. So let us assume that this is the baby, and there should be 2 people who should be doing this, because one has to hold the leg and the arm of the baby so that the area gets exposed. What you need for these the colostomy care is a nappy kind of a cloth, which you get easily at homes. You might use a muslin cloth or these gauze pieces. These are available at any chemist shop, or you can get a full gauze than and wash it in Dettol and dry it and cut it into pieces. Or you can use a muslin cloth, wash it in Dettol. You don't need to wash it in Dettol, or it does not need to be sterile, but it should be clean enough so that it doesn't cause any infection on the skin. So take around this much size of pieces of muslin cloths or gauzes, and a pad to cover the colostomy site. So, and we need some coconut oil. It can be any coconut oil that you have at your home. The purpose of coconut oil is to prevent the skin from getting damaged by the material of the intestine that comes out, or the stool that comes out of the colostomy. So we need to make a proper film between the stool and the skin of the baby, so that the ingredients of the stool that comes out, they have some components that can cause irritation to the skin, and they can cause rashes on the skin. So we basically want to prevent that, and that will be prevented once there's a film between the skin and the stool contents. So that is made by coconut oil. So see, you can innovate these methods in your own way. So this was a method told to me by a mother, and it worked quite well for them. So I'm just recreating it so that it might help you, and you might add or delete some things from it as per your convenience. So this is a muslin cloth or a gauze dipped in coconut oil, and I'll just, first of all, if there is any stool there, you need to, people use cotton balls dipped in water. The water needs to be not dirty, so that there is no infection. It needs to be clean. So you can either boil the cotton balls in the water and then use them, or use a filtered water and just dip the cotton balls in the water and just drain the water out, and then clean it so that the skin of the baby is not irritated. So clean all the stool contents or the contents of the colostomy. Once it is properly cleaned, you just make a circle of this cloth or gauze around the colostomy site. Use as much as is required, so that when you cover it with the pad, this pad doesn't touch that much of the intestinal area, because that then causes some erosion on the intestinal area and some bleeding, and you might get worried about it. So just make a loop around it, and then you can take one gauze and just dip it slightly in the coconut oil and cover it, so that it's not that eroding to the intestinal mucosa, and put a pad, or you can always cut a diaper in this shape and put it over it. And then we need to tie it. You can always use the nappies which are normally made for kids. So you tie this thing. Make sure somebody is there to hold the arm and the leg of that side of the baby, because that gets to be a problem when the kid is moving. So you just tie it around like this. You can always take a soft elastic kind of a band. I'm just using a gauze to demonstrate, but you can always take a soft elastic kind of a band and tie it over here, so that the contents are not spilled upwards. And then you can cover this thing with a diaper as much as it covers. The key to this care is that you keep checking that if baby has passed stool, because once it has, it's always better to change this thing. So you might have to change it even 10 or 11 times a day. The only way to prevent the rash is keep it changing very frequently, so that, you know, even if there is coconut oil, it's still sometimes, if it is too long exposure of the skin to the contents, the skin can again get some rash. So make sure that you change this thing as frequently as you can. So and one way to do it is, once you feed the baby, after that you just check if the baby has passed stool, and if it has, then you change this dressing. If you have any questions, you can always drop us a message. I hope this video helps you take care of your baby in a